go. So we have our board members present. I'd like to acknowledge them. We have Ben Carr. We have Deborah Gusson, our vice president. We have me, I'm the president. We have Elena Camarillo. We have Mila Stigal, who is our secretary. Jessica Anakar, who is our treasurer. And, Jessica Anakar is our corresponding secretary, and Tammy Dye is our treasurer. I'm still recovering from COVID. I have fuzzy brain, so you'll have to forgive me. So next we'll have the land acknowledgement, and Deborah is going to do that.
Okay. It's green, it's on.
If it's green, it's on.
Got it. Let's see. Please join me in acknowledging the Coast Salish people. The land we occupy today is their ancestral land. For thousands of years, they lived on it, stewarding its resources with care and wisdom. Today, with gratitude, we acknowledge them and their elders, past, present, and emerging, and recognize that this land remains a vital part of their cultural sovereignty.
Thank you, Deborah. There's chairs over here if you'd like to come on in and sit. Okay, next we are going to take a look at the minutes from May 16th. These were all sent to people who are on our mailing list. And so I'm asking if there are any changes or corrections that anyone has to the minutes from May 16th. Not seeing or hearing any, I will mark those as approved. Thank you. And now we have introduction of guests, anyone from King County or off island. Is Megan Jackson here this evening? There she is.
Good evening,
Megan.
everyone.
Megan, tell them your relationship with King County.
Hi, everyone. My name is Megan Jackson. I'm the Interim Assistant Division Director for our Community Environmental Health section, which covers the plumbing and septic programs. So I'll be sharing a little bit about our septic code revisions later today. Thanks for having me.
Thanks very much for joining us. Oh, Teresa Mosqueda is also on the call. Oh, that's fabulous. And let me just get back to Zoom here. There we go. Teresa, could you speak so we can all see you? There she is.
Hello, thanks for having me. I'm on public transportation right now, still working on getting our metro lines out there for Vashon, but happy to be here listening in mode today. Hello, everyone.
Thanks so much for joining us. And who else is here from King County or off island that we'd like to recognize as guests? Okay.
It's Chris Lampkin from Councilmember Mosqueda's office. Also happy to be joining you all. And let me just tell you, Megan's presentation on the septic change updates is riveting. You all are not going to want to miss that.
So stick around for that presentation, which is at the end of the meeting. Thank you very much, Chris. Okay, community happenings. Today is the longest day of the year. How about that? And boy, it's amazing to see that sun come up so early and stay up so late. And Dig Deep is having a solstice celebration from 5 to 10 p.m. both Friday and Saturday, if you'd like to participate. And some other things that are happening on the island. June 22nd is the Fix-It Cafe from 10 to 2 at the Eagles Club. I highly recommend that you bring your broken items to the Fix-It Cafe. It is a marvelous, marvelous event and fun, lots of fun. June 22nd to 23rd is the Vashon Garden Tour, 10 to 5 both days, and tickets are available at Vashon Center for the Arts. July 1st, this is big news for all of us, the Midday Foot Ferry starts running. How about that? Departing Vashon at 9:25 in the morning, 12 noon, 1:30 p.m., 3:45 p.m., all summer, all this year. How about that? But wait, there's more. The new mobile integrated health service of Vashon Fire and Rescue also is now providing taxi vouchers. So you can take the foot ferry to Seattle midday for a doctor's appointment and a taxi to your doctor's appointment. Because this wonderful gift that is part of this. So isn't that fabulous for people who need to go to Seattle for doctor's appointments? And that's starting July 1st. Okay. Next on the agenda is an open discussion, which is why so many of you are here tonight. And because I've had 2 people request time on this part of the agenda, we're going to go with them first and then open it up to the rest. So the first person on this part of the agenda is Steve Bergman. And Steve, would someone give Steve a microphone?
Thank you, Diane. I move the following. Vashon-Maury Islanders care about protecting the climate. Initiative 2117, which will appear on the November ballot, would allow climate polluters to resume polluting our air and water for free. The Vashon-Maury Community Council opposes Initiative 2117 and commits to adding our name to the list of coalition partners on the number No 2117 website. And if you want, we have the website available if you want to go and look at it yourself.
Okay.
Do I have a second?
So we have a second, Ginny.
Thank you.
Seconded. Okay, so we've had a motion has been made and by a member. So this is how this works for folks. Any of you members may make a motion, but it has to be seconded for it to go further. And so this motion has been made and seconded. And now the way we do this is that we make the motion 1 month and have it seconded and have some discussion, but it's the next month we actually vote on it. That gives the community plenty of time to think about these motions and what they want to do about it. So that motion has been made and seconded. Now we're going to have a little discussion. If anyone has any questions for Steve about this motion, please raise your hand either electronically or in person here and ask Steve your question. Yes. Wait, you need a microphone. Someone want to run a microphone? They can't hear you unless you speak in the microphone.
What is this initiative?
The question is, what is this initiative?
So thanks for that question. So Governor Inslee nicely introduced the Climate Action Act last year that passed, and now there is a group that wants to put an end to this Climate Action Act. And so the idea is if we want to keep protecting our climate, we want to vote no on this ballot initiative in November. So a lot of progress has been made by our governor and our state, and we want this to continue. We don't want to stop it. And so in order to continue the action to promote the climate, we want to vote no for this initiative 2117.
Okay, thank you very much. That should take care of that. And now we have a lot of people who want to hear our next person who's asked for time, Katie Ballard.
Hello, everybody. I'm going to be popular to some.
Please
and
speak into the
unpopular to-
microphone.
I'm going to be popular to some and unpopular to others. But what I'm going to say has to be said. There's a lot of misinformation about the Thunderbird Treatment Center going on. I am speaking on behalf of a lot of people who are opposed to it. This is 2 minutes. Let me get through it, and then if anybody has any questions, I probably know more than anybody in this room about it because I've been following it from the get-go. Regardless of what people think, it is not a done deal. Seattle Indian Health Board cannot get a permit to create a residential treatment facility because it is not legal under the current zoning. And they knew that before they bought the building. On April 4th, a King County committee came to Vashon to hold a public forum to discuss new zoning for Vashon. 2 islanders stood up and asked if this plan included the building proposed as a drug rehab. These 2 people were immediately shut down and told that wasn't part of the discussion, yet it is. On May 14th, the new zoning for all of unincorporated King County was released, containing a section allowing any zoned residential 12 to 48 unit building or new construction to be turned into a drug rehab or psychiatric hospital. This is on anywhere on the island. It can be in anybody's neighborhood, not just the VCC building. Attorneys hired by concerned Vashon residents sent the committee a letter before they voted to move the new zoning forward. The letter explained how the committee was violating the Growth Management Act by not giving mandated early and continuous public participation and 30 days notice of public hearings on the proposed amendments. The proposed new zoning was released on May 14th, one day before the May 15th and 16th public meetings. The public had one day to peruse 700 pages and provide comments, one day. The committee voted to push this new zoning forward anyway, except Reagan Dunn, without proper notice or community input. The final vote on this new zoning is in December. This is not a done deal, and I want to let everybody know who is opposed to this that your voice matters. You shouldn't be silenced. This island location doesn't make sense to have psychiatric hospitals or drug rehab hospitals. We don't have the infrastructure, and I've done a lot of research, and it'll also be dangerous for the patients who are brought here. So I move that our Vashon Community Council inform King County Council members and the executive that Vashon Island residents must be given their legal right to a public forum about this new zoning that would allow drug rehab and psychiatric hospitals in any residential neighborhood on Vashon. Do I have a second? Second.
So who seconded? Your name again? Laura. Thank you, Laura. Okay, so a motion, and could you send us the actual wording of your motion so we?
Absolutely.
Great. Yeah, that'd be great. That way we make sure we get it accurately in the record. So it's been moved and seconded, and now we can have some discussion. The actual vote won't take place until August because we're not having a meeting in July. Who would like to speak or ask questions about this motion? Yes, could you speak your name once you have the microphone, please?
Just to second Katie's motion, I want to read just a paragraph out of the Washington Administrative Code. This refers to an opioid treatment programs and agency certification requirements.
Steve, maybe you could hold it for me.
Okay, that's fine, I can hold it. The code states, ensure that a community relations plan developed and completed in consultation with the county, city, or tribal authority or their designee in order to minimize the impact of the opioid treatment programs upon the business and residential neighborhoods in which the program is located. A community relations plan is a plan to minimize the impact of an opioid treatment program as defined by the Center for Substance Abuse Guidelines for the accreditation of opioid treatment programs. Now, I would submit that there are other sections of the code that also address this need where community input is required before you proceed. And I suggest that the county considers that because it's included in the Washington Administrative Code.
Thank you very much. So we're going to keep questions and comments to a minute, and it's time now to ask for someone who would like to speak against this motion, if there's anyone. Online or Zoom? Okay, all right, then let's keep going. Anyone else like to say anything? Oh, there's a, yes. We need your mic. We need to have the mic, thanks.
Hi, my name is Selena Yark, and I just want to let everybody know that I'm going to be launching a monthly poll that will be regarding issues on Vashon Island. So I'm going to be hopefully I haven't talked to Thriftway yet. I'm going to be in front of Thriftway and IGA, hopefully on Facebook, and I'll have a website to track all the results, and it'll be monthly, and I'll be taking suggestions for topics that people would like to know the results of, and I'm hoping that it'll be useful to the community council and you know, all of us to just understand better how people are feeling about issues regarding Vashon. Thanks.
Thank you so much, Selena. Does anyone have any questions for Selena about her proposal? Did you want to comment on what she said? Okay, yes. Okay, Armin.
Hi, I'm Armin Yusufian. I've been on the island since '81, seen a lot of changes. This organization recently passed a motion with regard to PSC that there would be the opportunity for community input on an issue arguably of community concern. This seems like as big or bigger an issue of community concern, so it's right down the same precedential action of this organization to have community input. So that's my 2 cents worth. Pro or con, there should be community input.
Thank you, Armin. The text of the proposal, where can we see the text of the proposal? Right now, this is the text of...
for them to give it to us.
She handed. Oh. So this is, I'm not sure where the exact motion is. Oh, there it is. The motion's at the very bottom, right? Okay. Well, Teresa, are you with us? I don't see her. She's not on anymore.
Hey, Diane, I'm here. I just got off the bus. What was the question for me?
Oh, okay. Okay, so the question was, there's been a motion that's been moved, hasn't been voted on yet. It'll be voted on in August, and I want you to hear it. I move that our Vashon Community Council inform King County Council members and the executive that Vashon residents must be given their legal right to a public forum about this new zoning that would allow drug rehab and psychiatric hospitals in any residential neighborhood on Vashon.
Oh, yes, I heard the discussion and the presentation before. I look forward to hearing more. Thank you for making sure I heard it.
Okay, very good. All right, so I want double check if there's anybody on Zoom, because we've been just taking questions here. Anyone on Zoom have a question that they'd like to ask? Okay. Jenny Bell.
Hello, everybody. Lovely to see so many people here. Quick update from the PSC Activity Committee. So I'll kind of go like halfway. So put your hand up if you can't hear me. Okay. Most of the people on the back wall can, but I'll go loud. I'll do my big voice. So, PSC Activity Committee, we have an important petition here for undergrounding on our island of our electrical lines. This is looks like it could be the magic bullet that solves everything. So many people, their first instinct is to say it's too expensive, but PG&E in California put out a statement that undergrounding lines is 99% wildfire resistant and the lowest long-term cost for customers. The reason is overhead lines are about $2 million per mile, and every pole is planned to be moved back on our island 10 feet from the side of the road, so they're moving anyway. Let's go underground, because undergrounding in California, they're doing a version called on-grounding. It's 2.2 million per mile, no trees cut, no eminent domain actions, which are occurring on me right now, and property rights intact, no 75 and 80-year-old trees like the ones that have been cut down on my street. this last week. Pardon the wobble in the voice. So if everybody in the room could sign this, I've already got 100 signatures just from last weekend, because it's really, well, from my perspective, a no-brainer. So I'm very hopeful that something wonderful will come from this, so that if you could all sign this, walk this way.
Just, maybe you could just pass it around or put it on the table. Yeah, rather than getting up. Okay. All right, we have a few minutes left, 5 minutes left in our open discussion. Speak up.
Okay. I'm Connie Casperson, and can you hear me? Okay. Right. I thought they couldn't hear me over there. I'm coming new to this issue of the rehab center, and I'm concerned because what it looks like to me is like whoever's in charge has done a really, I don't know if I would say a good job, but have made an effort to kind of sneak this in under the radar. And so, okay, and should I stand on my chair? Okay. So, oh, you don't want to hear that. Noah? Okay. Anyway, well, okay, I'm just concerned because it feels like they've done a pretty good job of trying to sneak this in under the radar without really being there to answer questions, to give us real facts and details. So when we're talking about impact to our community, I'm thinking things like, what is this going to do to property values? I want those kind of answers. I want to know how my kids are going to be safe when some of those people who are here to get the rehab happen to wander out. Because we don't live that far away. One of the reasons we live on this island is because I can let my girls go out and go jogging or go running, and I don't really have to worry about them. That will change. That will change. And so I want to know from somebody who has the real story how this works. How are these things going to be addressed? How are you going to put this in and see that my family is safe, see that our investment in our home and our property isn't just for nothing, and also for the rest of you. So that's all I had to say.
So,
Jenny, people on the chat are asking how they can sign your petition if they're not in the room tonight.
Diane, is it possible for you to share that survey link from the last PSC Activity Committee email? It's in that link. So
I'd have to find it.
It'd be too hard.
Yeah,
Is there anyone here on the?
Give them your phone
I might be able
number.
to. Oh, okay. Jenny Bell 111 at protonmail.com. That's Jenny, JENNYBELL 111 at proton, PROTONMAIL.com. And yeah, make sure you do email me. Super important.
So this is the end of our this particular part of the meeting, but I want to let you know that we have the opportunity we're planning right now at our September meeting to devote a full hour to the discussion of the Seattle Indian Health Board and the treatment center. Because I know a lot of people want to talk about it, we don't have much time here. So we'll see you all back then, and I hope you'll come to the August meeting anyway. And stick around, please. So we're done with that part of our discussion. We're moving on so that we can keep our meeting on time. And now we're at the results of the board retreat. Where to next for the community council? And Deborah Gusson, our vice president, is going to share a summary of that for us.
I'll do that in 1 second. I was riveted by the conversation. I got sidetracked. Somebody share it. Great, I can't find it. All right, I'm going to
find it for you. You can start.
All right, I'll speak extemporaneously because I cannot find my own notes. It's terrible. So we had the board met at Tammy's house week before last. Tammy very graciously hosted us all at her house. All of us were there, and it was really an opportunity to just talk about what's been going on with the community council, the current board, and some transitions and opportunities that are coming up. And, I think there's been a lot of input this year about, how the community council can serve the community, optimally. What does that look like? What should the council continue to serve as we go forward? And we have big challenges ahead, one of which is Diane will be stepping down as president in November. We have board elections in October for a new slate of board members. Some of us may be continuing, but probably not all, definitely not Diane. And that will be a huge change. Primarily, you all might know, some of you might, but we are all acutely aware Diane probably spends 25 plus hours a week on this role. Nobody else is going to do that, frankly.
My husband will get to know me better again.
So it really raises a question about how will the council and the board continue to function. We really hope that we'll have more people who will step up and be interested in being part of the board, because the more of us there are, the more we'll be able to spread the work around and continue to function. But a lot of really good discussion at the retreat about what are our priorities, what are the highest and best values of the council, and want to hear from you all in the coming months about what that looks like and how people would hopefully like to join us. We will be wanting people to step forward and let us know if they're interested in running so they can be on the slate for the October elections. I think those were we had a really good discussion. Elena led us through a discussion around mission and values that helped us sort of get our thoughts together. Tammy helped facilitate it. It was a really good discussion around sort of how we've done the work that we've done and how we want to continue to serve in whatever way makes the most sense. Am I missing? Was that the most of it?
No, that was the most of it. Yeah, and so we're already implementing some of the changes that we talked about at the board retreat. For one, we put that free-flowing discussion at the very beginning of the meeting. We just had it. And it used to be at the end. And it used to be cut off sometimes because the people wanted to speak longer and we ran out of time. So now it's at the beginning. So if someone wants to really say something to this organization and say something to the community and then get it off their chest, they can do that. And they're never going to get cut short this way. So that's one thing. And the other thing is we're leaving more time for every topic so that there's more opportunity for people to comment and ask questions and hear each other. That means that updates from different organizations will not be heard here. We want to reserve the time for community discussion as much as possible.
I think, just to, actually, my memory's jogging. So Diane also led us through a SWOT exercise, strength, weakness, opportunity, and threat, which was really helpful because, as any of you who've done those kind of retreats, it is really good to look back and see what's going on. And certainly during Diane's tenure, there's been a lot of improvements and a lot of things have happened over the last couple of years. But even before that, there's, the history of the council is really interesting and it's evolved over the years many times. So we know it will again. And so the questions are, how is it going to, what will the next phase of the council look like? I think certainly we're hearing and wanting to make some of those changes Diane said about really wanting this to be more focused on a forum, really the town hall version where people can dialogue about issues of importance and agree and disagree with respect and civility, and that's probably one of the best uses of this organization. So how do we offer that in a way that makes sense to people? How do we find out what those issues are? How do we gather that from the community so that we're not missing anybody? So good discussion, more to follow.
Yes, and we have some time in case people would like to offer more suggestions for the running of this organization.
Or ask any
questions. Yeah. I'm just looking at the Zoom folks here. Thanks, Ben.
Can I talk about Katie's proposal or just about what you're
No, just about the board. Yes,
Okay,
that-
the
that- we're
time
done
we
with that
got to talk about Katie's was very small, but we've listened to a lot about what you want to do to give us more time to speak.
That's why we're having a whole hour devoted to this in September.
Okay.
A whole hour.
All right, but I'm just saying, a lot of us came and had our hands up, and we didn't get to say anything.
And that's what we want to work on, but we're not there yet, I'm afraid. Yeah, but we'll get there. Okay. So let's go ahead with the healthcare district update. Tim Johnson.
Okay. I have 4 kids, so I have a dad voice, so you should be able to hear me. They're all grown now, but they remember that voice. I was asked to come here to give you a brief update on what's happening with the community council, or not the community council, sorry, that's my old role. The healthcare district, because of a couple programs that we have in consideration, and I'd like to start first with the one that we've completed work on, and that is a youth behavioral health initiative. Can you hear me at home? The district set about, after our dissolution of our agreement with CMAR, to create some strategic priorities for what gaps on the island needed to be addressed. And the 3 gaps that were given the most priority were making sure that we backstop primary care, so there's always a clinic here, even if CMAR should decide to leave. The other 2 priorities were urgent care. That was a priority that was given to us by a very large percentage of the people we talked to on the island, as well as CMAR themselves. And the 3rd priority was behavioral health services on the island, because we are lacking in a lot of behavioral health services. And we've been through quite a crisis with COVID, and it's really brought to light a lot of the issues related to behavioral health. We started with our first phase this year on youth behavioral health, and I'm happy to say that we pulled about 40 different people together from various agencies on the island who have been working with youth, from the school district to the neighbor care school clinic to CMAR to VARSA, Youth and Family Services, Dove Project, school counselors. And we had a fairly robust discussion about what was needed most. And it came down to a very simple equation. Number 1, there isn't enough therapy available to students on the island. They're suffering through long waits, and especially kids with critical issues are being left off of therapy roles during the summer because their counselors are not available to them. Or they have to try and find another counselor. And anybody who's been in therapy or any kind of medical, whether it's body or your mind, knows that when you have a practitioner you're comfortable with, it's very, very difficult just to switch for the summer to a new one. So we also recognize that a large portion of the social service that had been done in the schools through social workers had been cut severely back. And part of that related to not understanding what all the needs were, not being able to help children access therapy services and other wraparound services. So the group formed a task force that then worked on a proposal, and I'm happy to report that as of last night, the commissioners have accepted a proposal for a behavioral health program for children. It is a 1-year pilot project with ongoing commitments should it work out. And what we are doing is several things. 1, we are adding a half-time counselor in the elementary school. The elementary school has a larger population than the middle school, but it only has a half-time counselor right now. And so we're doubling that capacity just to try and get some early intervention. This came to us both through the school counselors and through other practitioners, that they're seeing a lot of issues emerging in middle school that should have been addressed at the elementary level. The second thing that we're doing is Dove Project acquired a King County grant to put an acute needs counselor in the high school. They put in for a full-time grant, and King County funded it half-time. The district has decided to pick up the other half of that. We already have the counselor in place, and the counselor will just move to full-time. Main benefit of this counselor specializes in higher acuity patients and also will carry patients through the summer. So they will get the same service all the way through the school year and the summer. That's doubling that capacity immediately. The third piece is a social worker who will be specializing in wrap services, things like case management, dealing with family issues that result in behavioral health issues with children, prevention, education, really helping our counselors who are spending a lot of time managing cases to do more therapy while they have some support. The other role of that social worker will be to develop a needs assessment for us so we can understand truly what the resources that are being used and the resources that are needed. The last piece of the proposal is a data specialist. Will be a part-time data specialist working through Neighbor Care School Clinic, and that data specialist will be helping us implement some family surveys and tying all of the surveys that we are already doing together to develop a strong database and some metrics about performance of therapy and needs, so that rather than just guessing and talking to each other, we have some measurements about what's going on, what's happening, what's needed to happen. So that is the program that has been passed by the district as of last night. So I probably want to take any questions that anyone have on that before I moved on.
Boy, that's really late breaking news, huh? That was just decided last night. Wow.
My name's Steve Nurse, and I've lived here for 35 years. I have been getting involved, or at least trying to get understanding of the healthcare district and what's happening. And I did attend the meeting last night. I've attended several others. I have some real concerns about this. Number one, I have a concern about what I would call mission expansion. And when we first got this, when this was first proposed, when Vashon was in a real crisis, it was only going to be kind of basic care. And now we've just expanded out into all these other ways. I'm also really concerned about entanglements with the two organizations, with Dove and with Vashon Home and Family Services. Not because I don't think they need to have services, but last night, one of the other board members asked many times, what are your metrics? How are you going to measure this? And I speak to this from the standpoint that I have a master's degree in social work. I have done social work counseling for groups. And the one thing that they kept saying is, why do you need this? Well, our needs are great. Why do you need this? Well, it's an oasis on the island for services. One of the things that we need to do with this, and I think this is really critical, we need to set up metrics ahead of time. Otherwise, you're going to wind up a year down the road. You've got two different organizations. They both said, we've got our own metrics. We're going to use qualitative data. I can tell you qualitative is a cop-out data. Qualitative, we need quantitative. In other words, we have a responsibility to the taxpayers too. And if we're going to provide services, if we're going to pay for that, we need to have some way that there has to be some outcomes in this. I even suggested maybe it's something like maybe a kid goes in and has counseling for 3 sessions, and then you lengthen your sessions out, and then you have some kind of closure on this. But unless there's some kind of data and there's some kind of outcome that we're going to get back, I don't see any, it just doesn't seem to have any value to me. So and I think that that evaluation, that data needs to be done before they start providing effective services, and that needs to be done so that we've got consistent. And we need to have a professional survey done. The last thing I'm going to say is the survey that was done was speaking to the choir. I mean, I've got a copy of the survey here. I mean, it doesn't ask one thing about what's good about the island. It tells you everything that's bad about the island. So I think that we also need to go out to those other groups that aren't going to get the money from this, because now they're going to be a grant program, and they might as well put them down as a line item in the health services district every year. So my opinion.
Thank you very much for sharing your opinion. We have someone on Zoom who has their hand up, and that, Melvin, you have your hand up. Melvin, would you like to?
I think Tina Dawson was ahead of me.
Okay, Tina?
Actually, this is Mike Dawson.
Mike.
Two questions for our presenter. One is, what's the allocation of funds for the new program?
For the complete year, that's $268,000.
68,000. So one of the things that was brought up right at the beginning of this was, what are the overall priorities for the healthcare district? And
what's the mission statement?
Yes, thank you. It seems to me that the urgent care needs and the backstop for primary care services is really at the heart and soul of how we ended up with the health district to start with. And so the question is, if we have yet another crisis in primary care on the island, and if we can move forward with an urgent care program, what happens to this program? How does it rate amongst other priorities? Thank you.
Do you want me to answer that before we move to the next person? Thank you very much. You got the number, I assume, that $268,000.
Thank you.
To speak to the priorities, a little background on this. I happen to know a bit about the formation of the district because I was one of the people, along with somebody sitting over there, that was in a lot of houses talking to a lot of people about the district and also having meetings right in this very room. And one of the meetings we had in this very room related to Neighbor Care, who was our provider at the time, and who was not providing after-hours care. And as we talked about putting a district in place, we brought them out to ask what the cost of after-hours care would be and what type of services would be able to be offered. Unfortunately, we never got down the road with them because they pulled out of the location due to a lot of other geopolitical issues they have. We then moved on to CMAR, which required a very large subsidy to bring them out here. And that subsidy pretty much ate up most of the money that the district had in its coffers, along with the fact that the first entire year was operating under a loan from King County with no tax revenue. So that's a little bit of background. But the priorities of the district were always primary care is our first and most important thing to have on the island. We all agree about that, or most of us agree about that. And that was the primary purpose of the district, to make sure that there's primary care. The secondary purposes were if there are any resources and time and bandwidth left over to address other healthcare gaps that are on the island. CMAR came back to us, and because of some other programs that they have, were able to operate without the subsidy. We were left in a situation a year and a half ago of discussing with them the disentangling of our relationship. And one of the things they reached out to us about was, please look at after hours and urgent care, because that's not something that our model really successfully provides out here. So we also have been listening to our neighbors a lot. This is not a new concept. It's not a bait and switch. the behavioral health component of what we're doing is really important because when you look at gaps in care, the major portion of people's thoughts go to going to the doctor. Well, you know, the thing that controls everything you have is right up here. And we feel that behavioral health is health care. And it is a critical shortage. And making a small, careful investment, I see Steve Norris's point that we don't have all of our metrics in place, but we do have some metrics in place, and we have a method to get to metrics. And they're not going to be 3 sets of metrics. This is, by the way, the first time that all of these groups have collaborated on a project together. We have the school district, we have Neighbor Care Clinic, we have Youth and Family Services, Dove Project. There's also some other organizations that are helping on this. So it's a very large collaboration. It's the first kind of its product on this island. And one of our key goals is to assess need, to develop metrics of what services are being provided, what services are needed. So built into the process with the data gathering is the ability to build metrics that quantify, not just qualify, but quantify the amount of service, the amount of services not being provided, the gaps, where they are at, and be able to bring that back both to our board and to the community in a year so that we can look at a strategic plan about whether or not we carry this product forward and in what shape. The other thing is we have set our budget up to allow us to take care of primary care should CMAR depart. We are building a reserve, which allows us to immediately attract another organization should we need to and be able to subsidize them right away without raising any new taxes. We are keeping our tax levy below the rate we could charge, keeping that headroom for future operating costs should we need to do primary care. And we are also building our budget around all of the items that we want to get to and leaving some room for growth for those items. We really strongly feel that while some one-off programs are great, the most important thing that the district can do is provide sustainable services when it chooses to engage on something. And we feel until and unless we can find other funding sources for behavioral health services, that's an important component of what we're doing. And a lot of people have been involved in this discussion, and you know, we're really proud of it. So,
Thank you, Tim. I think we have another. We have a. Is there a question? Anyone have a comment or question? Okay.
Yeah, I do.
We have Scott first, and then we'll go back to Zoom.
Hi, my name's Scott Harvey, and first thing I want to thank Tim and the board for their service and for what they're doing for the community. I really appreciate their efforts, but I have some concerns. First thing was I understand you, I appreciate the information and the explanation regarding the behavioral health. I read in the Beachcomber about your plans to try to get into urgent care with dispatch health. Now, I understand that you're still in negotiations, but you must have at least an estimate of how much that would cost if they were to join it. Do you have the number for that at that time?
Sure.
Go ahead.
I'd like to answer the whole thing, so if you can just
okay, well,
give me all the questions, I'll hit them all. And if I don't get them, you can grade me.
That's the first thing here. The other thing here too, which in the Beachcomber, I'm reading about the fact that you're maintaining the property you have on the island because it would be available for future multiple uses for it. So I'm very interested in seeing what these future multiple uses are for that property along that line here. When I voted for it, and when a great majority of the island voted for the hospital district, it was to basically to save the care that we have here. Onwards, I really believe that that what you have are very good onwards ideas, urgent care, behavioral situation, possible medical vouchers and such here. But I really believe in fairness onwards to the community here that we need to have another vote. And I 100% support whatever the island wants to do onwards. But again, what we have now is not what we voted for. And so what we need to have is basically a very simple thing here. And where it should be in the ballot. This is what we voted for originally, and here's how the vision has changed. Do you support it? Yes or no? And I think it's be really simple here. You have the money, and I think before you go forward, you ought to make sure that the whole island who voted for it in the first place still supports it. So, but I'd like to have the two answers, please.
Yep, I'll get back to your two answers. The first answer is not conclusive yet, but I can give you a range based on what we're looking at. But I want to back up and say we are in discussions with a proposal from Dispatch Health. That does not mean we are moving forward with Dispatch Health yet. We are still in the exploratory process. One of the problems we had is we initially looked at a bricks and mortar solution, your typical walk-in urgent care, which is part of why we hang on to the property. That process went a long way with MultiCare's Indigo subset. At the time of their decision-making for the year end, they just could not justify the budget to make a huge investment in bricks and mortar on something that would take a couple of years for them to complete the process on. So they took a short-term pass and asked instead, would we talk to their other partner, Dispatch Health, who delivers the same type of care you can get at an Indigo. They just bring it to you. It's mobile. At that time, we were engaging both with CMAR and with the fire department because those are the two groups that urgent care sits primarily between. And CMAR did not have a problem with this at all. They're very familiar with MultiCare. They work with MultiCare. They encouraged us to move forward with this. The fire department, on the other hand, who is standing up a mobile integrated health program, which we have a lot of interest in, and we've been watching quite actively for about a year and a half since they first started talking about doing it. They have some concerns about overlap, which care would go to which entity. Would it cause billing difficulties? Would it cause revenue losses for the fire department? Would it duplicate services? That is where we are right now. We are in deep discussions with the fire department. I just spent a whole day this week over in North Mason County looking at that mobile integrated health program you might have read about in the Seattle Times that's doing a light version of urgent care that has some possibilities with its MIH program with the fire department. We are looking at a continuum right now of whether we should bring Dispatch Health in, add some services to the fire department all the way down to, is it just the fire department that needs to do this? There's no other fire department that's currently operating a full urgent care service. So we're still navigating a lot of things. It's complicated. I don't know how else to tell people that other than, you know, I've got a group of people coming out next week from Dispatch with all of our local island providers talking through the details of just what it is, what it isn't, how it would fit with other programs so that we can make better decisions. No decisions have been made. To get to your key question, which I know you want, the initial look at this program would probably be somewhere north of $500,000 a year. 5 to 7 would be an estimate, a range that the district would have to bear to bring it, which is pretty much in line on a per hour basis with what the subsidy was for the primary care originally on a, this would be a 7-day-a-week program, weekends, holiday, all of it.
And the information on the property on, you said there's multiple uses?
Okay, the property. Let me get to the property. The multiple potential uses for the property are unknown at the time. The original purchase of the property was for a new clinic. When CMAR chose to move forward with a clinic on their own, we negotiated to let them have the property. That didn't work out in the way that their structure worked. They did not want to take on that property and an entanglement they needed because of some of their federal and state funds to have sole control of that project. And they chose a piece of property that was suitable to them. They were a little worried, to be fair and honest, that coming apart from the district, there might be some ill will and a loss of a lease up there, and they wanted to have a building. That was my intro to the district as its superintendent. I had to come in at the moment everything was coming apart and sort of try and get the two groups together. We since have an option to buy their clinic. Once they build their clinic, which they're finding out in King County, takes a long time. But once they build their clinic, they will give us first right of refusal to buy it should they leave. We would buy it at a fair market value minus the contribution that the state funds that we had originally raised for a clinic that were then turned over to CMAR. So that state funding would pass through with the clinic, unlike what you've seen with the VCC building. They would not profit from that contribution. Where was that? We don't know at this point what we're going to do long-term in terms of urgent care. Urgent care might have a walk-in component. It might not have a walk-in component. So at the current moment, we're sitting on a piece of property that requires very little to maintain. Actually, I was out there today. We were cutting down the grass and working on getting those buildings set for demolishment. But we're holding on to an asset that is really, really fundamentally valuable, paid for. The person who bought the property and then turned it over at cost to the district did so under the auspices of he wanted it to be a community project, so we have not been really interested in selling it to some developers. If we do not need it for medical purposes, there may be the possibility of giving it to someone else for housing purposes or whatever method is necessary to dispose of the property in the highest and best community use. Right now, there's not a potential use for it that has raised its head other than potentially down the road. So we're just maintaining the property as an asset.
Okay.
Okay, well,
Has
thank
he
you very
answered your
much.
Questions?
Yes.
Okay, very good. So now, Melvin Mackey, would you have your hand raised?
Yes, thank you. Yeah, Tim, thank you for all the work you and the healthcare district have been doing. I think your assessment of what the needs are on the island sound good to me. Maybe the one that you're able to work on may not be the top priority, but you need to do something, so that's a good start. But my question, I'm a little bit confused because the school district came to us and said the state is not funding them enough. And we passed levies and we added money to the school district and they still don't have enough. And so it seems to me like a lot of this things that you're proposing for healthcare for young people by adding more staff to the school system is propping up the school system instead of the community at large. Because if the schools were doing what they were supposed to be doing, they wouldn't need the money to staff these positions that you're talking about. So, I mean, it seems like we're paying taxes for the healthcare district and we're paying taxes for the school district, and it's all going kind of to the school district in terms of staff support. So I guess I'm a little confused about that. Can you enlighten me?
Yeah, School District, one of the first issues we confronted was how to engage with youth behavioral health in a way that was effective while maintaining some control of how the money would be spent. The school district, as you know, has been going through a huge budget cut. I met with their superintendent, and I think I can speak freely for him that he had two things that he really would like from me, which were don't make me pick up another piece of the tab for something you put in place, and don't make a huge administrative burden for us. So this project is not actually a school project. This project is primarily delivered through at the school because almost all of the behavioral health and healthcare resources for children on the island come through that area. Neighbor Care Health, who runs the school clinic, will see all children on the island, regardless of ability to pay. If you have insurance, they'll bill your insurance, but they will simply see any child on the island at that clinic. They also have behavioral health services, as does Youth and Family Services and the Dove Project. Because all of the children are primarily being shuttled through the Neighbor Care school system, primarily for behavioral health intake, that is the proper point at which to inject some help. The social worker will be working with that clinic. The two counselors who will be hired by Youth and Family Services and Dove Project will be working in the clinic or in the schools during the year and then outside of the school when the school year is gone. They are not actually employees of the school. The school district is not funding any of this. We are simply collaborating with their counselors who are overloaded and their lack of social working staff to make sure that we can address some of the needs that they're just not getting to. I would love to tell you I could get the school district to pay this out of their budget. We realize it's not going to happen. And it was a really important thing to us to have some immediate help and also to assess the problem so that we can look at a long-term solution, which hopefully will include some school district funds down the road.
So I'm going to ask if there's any questions in the room, any additional questions in the room for Tim? Yes? You need a microphone?
And I want to say thank you. I realize this is like a merging of like two meetings. Like I acknowledge that there's also a healthcare district meeting that happens monthly, and this energy would be really helpful to like continue in that room, because this is also like a merging of different community members and consciousness to the different events. And then just something that I was struck with in this conversation that felt important that I wanted to like just kind of like call into language for is that like there was a term about primary care, and when this health district was like first formed and we voted on it, like, and people, you know, we were all talking about like maybe our concept of what primary care is or was at the time has changed. We received different primary care even at the healthcare center that existed previously, a couple iterations over. So the idea of our expectations of what is primarily necessary and basic care is like also fathoming to change, that it's like including mental health care as well as urgent care as primary needs for our community, as we've seen like hardships to accessing basic care when it has to be scheduled out, or with the ferries being limited to access any care outside of the island, and the fire district really taking up the stronghold of being like after hour care to like mitigate that. I just want to say, like, I'm impressed with all the things that are going on, and that, like, I'm just recognizing our focus on some of these words for primary care or like these different aspects could be something maybe we can think about ongoing. And I just appreciate this conversation that is happening. Thank you all for the work.
Okay, thanks. And now, Sharon Briskman, would you like to ask your question or say your comment? Oh, you're muted, Sharon.
Okay. I want to, of course, add my thanks to the work that's being done. And mine is sort of a, pardon me, a follow-up to the previous gentleman who spoke. I'd like to know what the hospital district's definition is of urgent care, because I have one definition, but I've never heard what the hospital district considers urgent care. And I will leave the primary care issue to another time, but urgent care is what I'm most concerned about.
Sure. That's actually a question that we've gotten a lot and that we continue to ask and get ourselves, because you talk to any organization and they will give you a slightly different version of what urgent care is. But there's a generalized version of what urgent care is, and that is non-emergent care that needs to be seen within the next couple of days. So not something you'd call 911 for, and not something that you wait for an appointment in 2 weeks or 3 months, as the case may be. We will be putting out some scope of care once we dial in what which partner and in what way we're working together. But the idea is very similar to a walk-in urgent care center, where if you have sprains, COVID, some other minor ailments, aches and pains, no heart, chest pains, no blood spurting, those are the things that you would call the 911 for. But if it's not a 911 call and it's not something that you would wait to see your primary care provider about, that is the zone in between that we're looking at in terms of what services we can provide for urgent care.
Okay, any questions in the room? Oh, yes. Yes, sorry, I didn't see you. Sorry, Marvin.
I don't know this guy. Who's this?
Yeah, Tim, I have a lot of respect for you. We've known one another for probably 20 years or something. I want to reiterate what Scott Harvey said, and I hope I don't embarrass Scott, but we both have MBAs in like accounting, finance, so we're very quantitative, to satisfy Dr. Nurse's comment. I'll start with a simple question. The tax base on the island is probably now around $4 or $5 billion. And what are you currently charging for a levy rate? I mean, if it's 50 cents per thousand, that's $2 to $2.5 million a year. What are you pulling in these days?
You know, I don't know the exact rate because they just reset it this year, but we are pulling in 1.95 million. So the property values just went up again in several areas, so that we're probably right around the 50-cent mark
Okay, so
on
you're
one
right in the
side or the
ballpark.
other. I could get you an exact answer.
That's fine. That's
I
good
just
enough.
learned I don't deal in the actual rate as much as I deal in the amount. The county deals in the rate as long as we're within our amount. And we don't need to be pro-rationed. We deal in a net amount. When we send our budget in, we do not send in a per thousand estimate. We send in what our budget is.
No, that's fine. You confirmed that you're in the range of what I thought. So we're back to what Scott was talking about. I want to just reiterate that. I and many others feel that when we passed this thing 4 years ago, it was to subsidize the provider to the tune of $700,000 to $1 million a year or so. And now CMAR doesn't need any subsidy. And to build on Dr. Nurse's comment about mission expansion, I call this mission creep on steroids. We've gone from subsidizing an operation for $700,000 or $1 million a year that now doesn't need the subsidy to $2 million a year for things that were not what people originally voted for. They may make sense, but this thing should be put back to a vote of the people. And people were saying that in the very beginning, that they feared that there would be mission creep, and then the only recourse would be unless the board voluntarily put it to a vote, that there'd have to be a recall campaign or whatever it's called. So that's one comment. The other is the fire. I was a volunteer with the fire department about 15 years ago after I retired 20 years ago. And what I discovered, I probably knew it already, but 95% of the calls the fire department responds to are medical, not plural. So basically, urgent care on the island is there. It's in the form of the fire department. They make house calls, very expensive house calls, because the budget now is like around $8 million a year. If you take 1,000 calls a year or so, do the math, it's like $800 a call or something. But anyway, we already have urgent care, and the recent levy lift that we approved with the fire department that has increased everybody's real estate taxes, and that goes on in the form of increased rent for the renters who are well-known are struggling. We already have that, and now you're creeping into that same territory. So like, I forget the gentleman's name, I've known him for 30 years, in the upper left corner, who said that he's confused. I'm confused about what all we're doing. But I think the bottom line is this should be put to a vote, and up or down, people should have the opportunity to weigh in on this.
I would want to address just the factual nature of that. The fire department does not provide urgent care. The fire department is limited in its ability to come out and in its response model to treat wounds, stabilize so that you can go to an urgent care or transport you to an emergency room. They are not allowed to diagnose or treat without transporting a patient. I'm not going to say they don't fudge the line a little bit here and there, because I would never say that in public, but they are not capable of doing that. They do have an MIH program, which is now starting to provide some chronic care through a nurse, an RN, but the RN is not a practitioner, which means cannot prescribe, cannot diagnose. They have a scope of services they are doing. That is part of the reason why we are talking to the fire department about where their MIH is going in terms of urgent care, because both of us realize that they are not providing urgent care right now, and I wanted to make sure that that was a factually clear. Okay, but even their medical director. Okay. The other piece of it is I totally respect your opinion, and I work for 5 commissioners who are elected by all of you, and we would welcome you to come out to a meeting and engage with them on this or any other subject. We have a hard time getting people to show up for a meeting. Most of the time we're working really hard. People ask us what we're doing, I put out a packet twice a month, and we have an open public meeting, and we invite everyone to come, and we make it available by Zoom. We've even got a meeting owl, so it looks like you're sitting around the table with them. We're trying really hard to engage, but I understand it's a business meeting, and most people don't want to show up until it's something they want to. But we encourage you. I will take your thoughts, all of these, back to our board in a report and let them know that these are the sentiments that were raised. But I would encourage you to come out and engage with the commissioners themselves. One of the things that they are going to be doing in the near future is starting what we used to call office hours again. They'll be out in front of a coffee shop or a supermarket once a month so that people can stop in and just ask questions. But you can also email, you can go on the website. We're attentive to what people want. And please come share with the commissioners. I'm happy to give them that input. To be fair and honest with you, the way that a district is dissolved, a public hospital district is dissolved, it needs to be dissolved by or its own commissioners and a judge, meaning the judge has to agree that the commissioners are acting in the public's best interest. So dissolving is a fairly arduous process to undertake. Resetting the levy is solely the responsibility of the commissioners. So if you want some input or you want them to put a referendum together, please come out, give us some information on that, exactly what you want. I'm happy to give you time at a meeting to actually present on this. We are here to actually serve the people we're among. That's why I'm out here tonight, not hiding anywhere else. Happy to have you at our meetings. We meet on the third Wednesday of every month at the Presbyterian Church. You can log on to our website and get on Zoom. It's really easy. We have 2 public comment periods. And while we are not as diligent about our time constraints, we usually let everybody who wants to talk get their word in, and if we can't, we'll get you right back out at a future meeting.
Speaking of which, we have one more person who has a question, and that'll be it for this event, for this item on the agenda. Linda Fox, please unmute yourself.
Hi, I just wanted to agree with some of the previous speakers, and I disagree with you, Tim, a little bit, but I don't know. So I've had the MIH, is that what they call themselves? Mobile, okay, or mobile health, anyway, to my house, and I've talked to them about what they do and what they're trying to do, and they have a 3-person staff, as I understand it. They have a coordinator, and then they have an RN, and then they have an EMT. Now, EMT and the RN coming out to my house is a pretty darn good duo, you know, and they are doing, I mean, urgent care doesn't necessarily need to have a diagnosis. They just need to be cared for. If they're bleeding or whatever, they will take care of it because it's an EMT that knows how to do it, right? And anyway, the nurse was giving me advice about blood pressure and stuff like that. So they both have their reasons to be there that I think are really good. And I'm really looking forward to them continuing and enlarging their trial project, you know, from once a week to twice a week and however they're going to do it. And I think that since they're doing that, I don't see that we need any other kind of urgent care mobile that goes out to people, unless somebody thinks that nurse should be a nurse practitioner, perhaps. And that might be the only thing that needs to be changed. And so I think that money, that extra money that you have, can be given some other reason and going through the process like they've discussed in our voter process. And like what you just talked about you're doing right now with the behavioral health, not that I disagree with it, it's just that I think that should have gone through the public as well as a vote.
Okay, thank you. I appreciate that input.
Okay, that's it for this discussion. Thank you all very much for your questions and your answers and your comments. Thank you, Tim. Okay, next we have the discussion. We have a vote on the community heritage trails, and Steve Bergman is going to walk us through some slides before we take the vote. So with this motion was made and seconded. at a previous meeting, and now tonight we're going to be voting on it. So Steve is the person who made the motion, so he gets to speak first to the motion and last to the motion.
So I just have a few slides. Thank you very much, Diane, for that. So our island has an amazing history, and our group in Ellisport is trying to celebrate that amazing history by constructing a heritage trail in the neighborhood constructed by community volunteers in Ellisport. We've run up to some problems, though. Next slide, please. In that there's a King County sign ordinance that prevents us from erecting these signs. So not just Ellisport, but Burton has also been building a heritage trail program. And these are interpretive signs on walking routes that really celebrate the over 150 or million year history that we have on the island, because we discuss the geologic history as well. The whole idea is that these signs enhance the community identity, and they're designed to be attractive and educational with text and pictures of historical images. Similar to the existing signs that you've seen in Docton and at Tahlequah. These are very low profile signs. They're only 3 feet off the ground or so. They're tilted. They do not block any beautiful landscape that we have or beautiful views. These aren't going to obstruct the views, trust me. And the signs are voluntary in the neighborhood. They require the parcel owner's permission and their approval of where they're placed. We'd like them placed fairly close to the boundary of individuals' parcels so people walking on the roads can read them, which brings them within the 30-foot right-of-way that King County sign ordinance deals with. So just next slide, please. This is an example of what the signs would look like. These are Docton signs. You can see they're about anywhere from 9 to 20 inches to 23 to 29 inches in size. They're tilted, they're very low profile and attached to the ground. And they're meant to be read and appreciated. Next, please. Here's an example of the one at the ferry dock on the south side at Tahlequah. Next, please. And these are 2 examples of the 13 signs that we've designed for Ellisport. Our neighborhood community, these volunteers have worked for the last 7 years following the Chautauqua events and the museum exhibit to build these heritage trail signs, the hidden history trail we're calling it. And you can just see some of the examples of the old sawmill that used to be at Ellisport Creek, the 20 greenhouses that used to be in the ravine in Ellisport. All these are lost now, they're gone, but by having these in the position where the viewer can see what used to be and the way it is now, we think would really build the community and increase the appreciation for our locale and our island. Next, please. So it turns out this year, King County has funded both programs from the Allen Painter grant. Ellisport received $4,000, and we have matching funds to pay for the signs. And we've had literally thousands of hours of volunteer time over the last 8 years to construct and design and build these signs. However, the King County Sign Code 21A.20 makes it illegal to place these signs where they need to be placed, we believe. And so we are asking the county to amend their code and provide an exemption for Vashon to allow for these neighborhood heritage trails. Both the Vashon Parks District of Commissioners and the Chamber of Commerce have provided their support from the proposal. We've received letters from both of those groups. And this motion is asking for the Vashon Island Community Council to endorse this mission. So the precise wording of the motion is on the next slide. Vashon-Maury Island Heritage Trail community groups installing interpretive signs celebrating local history are proposing a King County Sign Code exemption be added to King County Sign Code Section 21A.20.030 to allow these signs on private properties and in non-obstructive road right-of-ways in our local communities. Therefore, be it resolved that the Vashon-Maury Community Council support the efforts of Ellisport and Burton communities to seek exemptions to the King County Sign Code in order to move forward with their Heritage Trail projects. Thank you.
All right, so that's the background, that's the motion, and now I will take questions or comments. Yes?
First off, when it said that Docton, or rather not Docton, that Burton and Ellisport are putting this together, they're not. Some special group is putting these together, because I've lived in Burton for 9 years and I've never heard about it until recently. Nobody sent a flyer or a mailer to my door. I've talked to people on the street in Ellisport. They didn't know about it. I've talked to people in Burton. They didn't know about it. So it's a reach to me to say that these communities are promoting this. They're not. A special group is promoting it, and I grant that they have no doubt spent 7 years and lots of effort. And I recognize that they have been supported by the Parks Department and the Chamber of Commerce. And I see that in their notes that came up on the agenda about this meeting, that they're saying that this network of island trails will engage and educate residents and visitors, bringing tourists to explore. But the job of the signage code is to protect our visual environment. Taking these signs out of that protection will be disruptive to our visual environment. And it's not just aesthetics, which are very important to me, but there are safety concerns as well. These are areas with narrow streets, no place to pull over, few places to pull over, few places to park. So there will be safety concerns when we add more traffic, pedestrian and vehicle traffic to the situation. And those signs have great content. I think they're wonderful, but I can read them online at the Vashon Heritage Museum. The exact trail that they want, physical signs that every day I would walk out in my neighborhood and have my experience of the neighborhood labeled and packaged for me. It'll be online. An online walking tour is a choice, and anyone with a cell phone can access it. But a physical sign is always there. It does what signs are intended to do. It calls attention to itself. I personally would rather experience my neighborhood in its beauty and with the character and community that it now has. So I ask you to join me in opposing this initiative. Thank you.
Okay, I would like to have someone from Zoom if they have a question or comment about this. Kim, please unmute yourself and share. Kim, you'll want to turn off your video because it looks like you don't have enough bandwidth.
Can you hear me now?
We can.
Oh, good. I think this is a noble cause to share the history of the island, but the solution seems like a pretty last century solution. Many communities don't allow signs. I think a variance to allowed signs in one situation will lead to more signs. It is considered in many communities visual pollution, especially on an island as beautiful as this. I like the idea of QR codes. I like the idea of apps that would make this work and attract younger people to the community. But what I'm really concerned about is changing a sign variance for a situation that may not merit it. And finally, I would like to see something on the maintenance of these signs. What happens if there's graffiti? What happens if they're knocked down? What happens when they go into disrepair? Who takes them down? Who does all those things? And I think it's a noble effort, but I just think there are better solutions that are more in tune with today. That's all.
Thank you very much for that. Now, I would like to hear from someone in the room here of the positive towards the sign, to mix it up quite a bit. Is anyone would like to speak in support of the signs?
Hi, I'm Lynn Kerrigan. I'm an Ellisport resident of 35 years. And I want to answer a couple of things. One is that the Ellisport group, which is proposing this signage variance, has spent years meeting with our community and surveying our community and correlating this with the history exhibit and the Living History project that was in Ellisport in 2017. So we've been working with the community for 5 years, really getting this proposal activated. Our community has been pretty supportive of it, and we have documents of those surveys there. I'm sorry it affects Burton as well, but some of the folks from Burton did come to us and ask what our process was, so we met with them. I'm very much in support of it because I think it is a really historic neighborhood, and I don't know how people would know to go on the Vashon Heritage Museum website to look at it. It's just something we may disagree about because we are in a very historic location. The only big concerns that have been raised are related to parking because we are so inundated with the visitors to KVI Beach down there, which is actually private property and should not really be publicized as a public beach. And the parking is just very unsafe sometimes, not always in blocks, fire department access. We are working and have been talking with the Beachcomber, the chamber, about those issues, the police, the fire department. So we do need to address safety issues. You're absolutely right about that. And I won't speak to the maintenance of the signs because I haven't been involved with that part of it, but I have been with surveying the community and getting so much support that we decided to go ahead with this a long time ago.
Okay, thank you very much. I'd like to have Linda Fox unmute yourself and state your comment, please, or question.
I just think it sounds like a really nice idea. And I agree about the having to go to the website thing would be a hassle. And how would you know it anyway if you're just out for a walk? But if you're out for a walk and you see the sign, I read them because I love them. You know, they give me a lot of great information. But there is, like, I heard the walking tour idea, like, you know, my kids were in Europe and they had this walking tour, you know, on their phones. So maybe you go to the website and you get something that you can take with you and it talks about where you're going. I don't know how that works, but that's another option. Thanks.
Okay, thank you, Linda. And Joanne had her hand up first, so.
I can kind of empathize with what you said, but also your presentation. And I can't say that I don't have an exact opinion either way. I'm just saying it's interesting, this discussion, but also what it brings up for me regarding signage, and I'll be brief because I have a lot to say about this, but I've been back and forth with King County Maintenance Roads lately for a few months about all the signs that are popping up all over our highway for like 2 signs, crosswalk coming, crosswalk here, different colored signs. You know, we have the typical yellow, but now there's bright green. I documented a lot of it on the north end of the island. I mean, it's unbelievable what I'm seeing, and they're popping up more and more and more. So I want to do a presentation about this in the future, and I'd like for people to start really looking at all this signage all over our island, and a lot of it is redundant and unnecessary, and a lot of times they'll put it right in front of a very majestic, sort of remarkable tree, and it's like, wait a minute, I used to come by and just admire the tree. Now I've got this big sign there. So it's an issue. It's junking up the entire town, but hopefully there'll be a bigger discussion later. But I appreciate the conversation about these signs, but signs are an issue.
Thank you. We only have time now for Stephen to talk one more time, and then we're going to vote. I know, but we don't have enough time for that and the vote and to stay on track.
So let me just add, I didn't have a chance to say this in the short talk, but we met with Steve and Steve Ice, his colleague, about making this most accessible to the disabled. We've got some great suggestions on providing translations in several different languages online, and to even have transcriptions made so people that are sight impaired could hear an audio transcription of the signs. We've had some great accessibility. We've received great community support. We've had multiple meetings in Ellisport, and if anyone wasn't aware of it, they were in another country or something, because we've had every mailbox was visited with flyers, and we've had public meetings in the neighborhood. In terms of your good comments, I totally agree with you about too many signs. Billboards, I think, are evil. These are not the same signs. These are very different. These are low profile. They're minimal, unobtrusive, and accessible because they're so low. And so that's good.
And now we need to.
Is it possible to bifurcate the motion between Burton and Ellisport? Because I know Burton not to be.
I'm sorry, we won't be able to unless there's a friendly amendment to this motion. It's going to go. Do you want?
And really, the motion is for King County to make Vashon wide.
Yes.
For other communities too. Gold Beach wants to do a similar thing. There's a lot of local communities that are interested in this.
So it's time to take the vote, and I have shared on the screen the motion so that everyone can see it again. I'm just going to read it for those who can't.
Order, are you saying a member can't make a motion to amend a motion?
Yes, a member can certainly. Would you like to? But you're not a member. But certainly a member can. So did you want to make a motion to amend this?
Me?
No. Victoria.
I would make a motion to amend it to only apply to Ellisport, because from all the people I've talked to in Ellisport, not the people who are here to support this, they don't support it, so I don't want to do that for them. So I'll just write that.
Okay.
I have a friendly motion, suggested question. Friendly amendment.
Go ahead. What you need a microphone.
Yeah.
Kyle Ritz. This is a point of inquiry and for the amendment for this. Is this, in clarity, is this specifically asking for this sign code section 21A 2030-030 to include only the addition of interpretive signs or any type of signs? Is it specific to interpretive signs?
Specific for historical interpretive signs.
And the friendly amendment would be to be clear in the motion so that people know that, we realize that there's different types of signs, but just to be clear in the motion that it's for that specifically.
Well, I thought we stated that right up front. Interpretive signs celebrating local history. I think it's really clear.
I just want that to be also just really made clear. I'm sorry.
So if this motion is passed, we'll make that part of it very clear. Okay, are there any other proposed amendments to this motion? Yes?
Just to be more clear, to change the words, the efforts of Ellisport and Burton community members who like the signs, because we live in Burton and have not been involved in the process. We walked Ellisport to see what it would be like, and we met people in Ellisport on the road who said they knew nothing about it. So the community has been involved, but not the whole community. And if we make that clear, it will be more accurate. But I think that's friendly.
Well, he decides if it's friendly or not you.
I propose we vote on the existing motion.
That is, okay.
Thank you.
Okay, that's what we're going to do. We're going to vote on this existing motion. Whereas Vashon-Maury Island Heritage Trail community groups installing interpretive signs celebrating local history are proposing a King County sign code exemption be added to King County Sign Code Section 21A 20030 to allow these signs on private properties and in non-obstructive road right-of-ways in our local communities. Therefore, be it resolved that the Vashon-Maury Community Council support the efforts of Ellisport and Burton communities to seek exemptions to the King County Sign Code in order to move forward with their heritage trail projects. And I'm going to put up a poll for the Zoom. I'm going to stop my sharing and get to the polls. And here's the question: do you approve changes to code in King County Code to allow for historical signs on private property and the road right-of-way on Vashon? And I'm going to launch that. And so that's going to be going in for the Zoom people.
Dan, if you want to call it out, I think Deborah's ready to help count.
Wonderful. And so for all the people in the room, all those in favor of this, please raise your hand.
Two of us, you know.
Mm-hmm.
Yes, only members may vote. 12 in favor. How many against this
We
motion?
don't see the survey or whatever it is we're supposed to see.
The poll is taking place right now on Zoom.
I'm on Zoom.
So you should be able
Scroll
to see
down.
it.
You have to scroll down.
Okay, because lots of people are voting, so a lot of people are seeing it.
7, no, 12, yes.
No, it's not going to do it. Turn on your video.
What?
Yes, how many would abstaining from members who abstain? Yeah. Okay, so I'm going to end the poll on Zoom. There's been no changes now for a while. And share the results. So we have 17 in favor, and we have 5 against.
71 in favor.
Diane, it
That's
sounds like some people were not clear. Can we do?
An in-person vote again.
Sure, we can certainly do that. Okay, so we're going to run the in-person vote one more time. All those in favor of asking King County to change the code to allow these signs, raise your hand.
Can you also do something so we can see where the poll is online? Because I don't see it.
I'm sharing it now. I'm sharing it online. It should be able to be seen. Is no one able to see this?
Andrea
I'll
and David
share-
can see it. Diane, we can see it.
I'm sharing my screen. You should be able to see it now.
We can see it.
I see it.
Okay, very good. Okay, so what's the number for the
12 eyes.
It's 12. Okay, still 12. Okay, and 17 online. And so the motion has.
Oh, we need to ask for the no's.
Oh, the new in person for the no's, please. Sorry about that.
I don't see it.
All those opposed to the motion, can you raise your hand, your members?
Okay, 8.
I don't see the poll.
I'm sharing my screen. You should certainly be able to see this. I don't know how you can't. Can anyone?
All I can see, all I can see is the verbiage of the proposal.
You stop sharing.
Okay.
That's all I see too.
Okay.
We can still see the results of the poll on our screen.
Okay, you can see the results of the poll.
David and I can, yes.
I don't
But
see
not
it.
everybody. I don't know how, I'm sorry, I can't explain why some can and some cannot. But I'll tell you the results. For the online people, for Zoom people, there were 17 that approved it, 5 that did not, that voted against it, and 2 that chose to abstain. Let's do the abstain again for the people here in the room.
Anyone
How many
abstaining?
members who are abstaining from voting? 3. Okay.
4 abstain.
Okay. Well, the motion has passed. Okay.
Good.
And could you total up for the
29 yes, 13 no, 6 abstain.
29 yes, 13 no, 6 abstain.
Okay.
All right, well, there we go. There's that. That has been passed, and so the Vashon-Maury Community Council will write something up, and Jessica Anakar, as our corresponding secretary, will send that off to the appropriate people. Thank you very much, everybody. And next, we have our community updates. King County has a septic system announcement to make, plus other community updates. And for all of us on septic systems, we'll be all ears. So, Megan Jackson, it's your turn.
Awesome. Thank you, everyone. So I'll be quick, as I know there's been a lot of discussion already this evening, but I wanted to let you know that we are revising our septic system codes here in King County. We are doing this now because the state has been through a 5-year process to revise the state codes. They voted on them in January and chose to move forward several new code changes at the state level. And because of those changes, each county has to have new regulations in place that align with those codes by March of 2025. So here in King County, we are trying to take the opportunity to align our local codes with those state codes, but also think about what are the other changes that make sense here for our county, and really trying to get as much input as possible from community members, people who use septic systems, people whose neighbors use septic systems, people who work on septic systems, to make sure that we are aligning our codes with the needs on the ground. So I'm going to put a link in the chat for those who are on Zoom to a website that we have available that explains the code revisions and opportunities to provide input. The link to this for those in the room is www.kingcountyoss.info. So King County OSS as an on-site sewage system.info. If you go to this website, you can see the revisions that we are bringing forward for discussion. These revisions fall into 5 different categories. So we are looking at certifications and oversight for the people that King County certifies to work on septic systems. We're looking at land use and development and making sure that the long-term use of properties aligns with the septic system that is on that property, and thinking about how do we really support property owners who want to put in accessory dwelling units or additions in their house. The third category is design specifications. So really getting into the nitty-gritty details of how do you have a right-sized septic system and proper setbacks and all of the other really detailed things that go into designing a septic system. The fourth category is repairs and remodeling. So thinking about how do we make it as easy as possible for someone to make the small repairs that are necessary to keep a septic system functioning, so that ideally we can prevent some of those bigger issues that require a full septic system replacement. And then the last category is operation and maintenance. So thinking about how do we really support property owners in taking care of their septic systems so that they will last as long as possible. So as you can see, there's a lot of content that we are looking at. And I really encourage you to go onto the website and look in more detail about the specific codes and different changes and considerations that we are bringing to the table. And on that website, you can also see different opportunities for providing comments. So there is a survey on there where you can provide comments about all of the 17 different potential code revisions. And then there are also public meetings that we are hosting. I would really like to encourage anyone here who is interested in attending a public meeting to attend the one that is on Saturday, July 27th from 3 to 5 p.m. There is an in-person option for this, but it is in Kent. So we have a virtual option specifically for interested people from Vashon Island, and we will be prioritizing and making sure that we focus on potential code revisions that we have already heard are of interest to people on Vashon. Like, for example, thinking about the time of sale inspection process and how to make that as streamlined as possible, or how to manage holding tanks, which some properties on the shoreline are having to rely on when they need replacement septic systems. So you can go onto the website and register for that meeting, or if you have any other questions, you are always welcome to reach out to our office. You can just call us or email us, and we are happy to provide more information. And I think that my contact information, as well as links to more information, were available in the meeting notes that Diane has and will send out. So I will leave it at that. And if there are any quick questions, happy to take those. But I also know that we are strapped for time. So Diane, back to you.
Okay, do we have any comments or questions? Yes, Jenny?
I want to emphasize to people just how important this is. This particularly impacts, in my opinion, the ability to build ADUs, which is a key strategy that I think will be successful in addressing affordable housing. I heard, I think probably many months ago, your original presentation, and the suggestion was that building space was going to be reduced due to climate change, so that the actual amount of space, so instead of us having this much, that it was going to be this much. Is that roughly correct, is my first question. The second question is, where did these changes come from? Because at the last time you spoke, it's, you know, I like stuff to come from our community rather than being downloaded. So I think these are really important questions. I'd encourage you all to have a look closely and have your say about this, because it's a big issue for our ability in particular to use ADUs to solve our affordable housing crisis.
Thank you, Jenny. Do you have any comments on that, Megan, or?
Yeah, happy to answer some of the questions. So for the first question about changes in sizing, so there are a couple of changes that are coming primarily from the state. So one change that they are requiring is that we do change the minimum lot size for new lots. So this does not impact any existing lots, but only those that will be subdivided after the new codes go into effect. So it really has a minimal impact. But the minimum lot size is increasing. So that could have some small impact on the ability to build on these properties. We have done some analysis for King County, and we, based on that analysis, this code change is only going to impact 30 properties that can currently be subdivided and will not be able to be subdivided after these new codes go into effect. So it's really a very minimal impact. Another change is that we are looking at options for reducing the drain field size, because we know that sometimes the size of the drain field can also cause limitations on how much the property can be developed and whether ADUs can go on the property. So that is something that we have heard from community that is of high interest and that we are really trying to prioritize as we are thinking about potential code revisions. The list of potential code revisions that is on the website came from community input that we have received over the past 5 to 8 years, as we have been talking with people in the community, and people have called us and told us what doesn't work. It also was from a comparison of the state codes and the local codes and looking at where the biggest changes are at the state level. And then we also have a technical advisory committee, which is a group of people who represent many different interested and impacted parties related to septic systems. So we have community members, both from rural and urban areas, on the technical advisory committee. We have the septic industry, we have realtors, developers, other people who represent environmental advocates and community advocates. And that technical advisory committee decided on these final codes to bring forward to community for conversation. I do want to be very clear about the fact that we are at the point in the code revisions where we are having discussion with community. None of these are final proposals. We want to hear your input about these potential code revisions and if anything is missing. So we are definitely open to that input and want to hear it.
Thanks very much, Megan. Does anyone else have a question or comment about these septic changes? Anyone on Zoom? I'm not seeing any hands raised there. Okay. Well, thank you very much. Thanks for that date for, this was just, is it just for Vashon, this Zoom call that you mentioned?
The Zoom call will be specifically
on July 27th.
For Vashon residents. If other people want to attend, to turn them away. But the content will be specifically geared toward things that impact the island and people who live on the shoreline.
Okay, Saturday, July 27th from 3 to 5 p.m. Okay, all right, so, yes.
Hi, I'm Rob Horsch. Just a quick comment. This meeting and the one before it where we heard from the septic sisters, maybe that was a different meeting. I can't remember
That was
which
a couple
meeting
meetings
was what.
ago, yeah.
Well, I didn't know where our septic system was. So as a result of that, we figured it out. We went online, great resources. We got the whole map and we had them come out and inspect. And they said it's good for at least 5 more years. So I was so relieved not to have to worry about it anymore. Thank you.
Thank you, Rob.
I'm so glad to hear that.
Okay, that's very good, yes. Okay, so thank you very much, Megan, and I will just change what I'm looking at here. There we go. And the last item on the agenda is our next meeting. So we will not be having a meeting in July. This is the first time in 4 years we haven't had a monthly meeting, 4.5 years. Instead, we're going to be very active at the Strawberry Festival. We're going to have information on accessory dwelling units, especially ADUs in the town core, because they'll be the cheapest ones to create. We're going to also have information on the Puget Sound Energy advisory committees, information with these possibility of undergrounding wires. And we are going to have a fundraising raffle, the Vashon Experience. So please do come, and we're looking for volunteers to staff our booth. And that's going to be Strawberry Festival. And then our next meeting will be Thursday, August 15th, and confirmed topics for August 15th. Tricia Davis will be here on King County roads on the Clear Zone road standards. And we're going to be calling for nominations for the Community Council Board. As a new board will be elected in October. So be thinking about that. And because of the visit from King County, we will probably want to have the vote on your motion move to the 1-hour segment in September. I think that makes the most sense. It's still timely for the whole system, rather than split it up, because then we'd have a small amount of time for the vote. Well, either we only have half an hour in August, which isn't enough time, or we have an hour in September. We could, but people will say, you haven't given us enough time to talk again. See, we could do that. Would you like to? I think so. Okay, so we can talk about that, but right now the vote's scheduled for August, and it won't have much time on the agenda. Okay. All right. There we go. Meeting is adjourned. Thank you, everybody.
Thank you.
What? Absolutely.
Thank you, Diane. Good meeting.
Thank you, Diane.
Thank you, Melvin.
Thank you, everybody.
Diane.
Thank you, Diane.